Hello everyone and welcome to this week's instalment of Coalition Conversations. My name is Fiona Kyle and I'm the CEO of Mental Health Reform. For those who don't know us, Mental Health Reform is Ireland's leading coalition for mental health. We are comprised of nearly 75 member organisations who represent a diversity of interest, from human rights to children's rights to disability, to mental health providers to research-focused organisations. All of these 75 members have one thing in common, is that they are working towards the reform of Ireland's mental health services to ensure that everyone in Ireland has access to the best mental health outcome that they can have. As always, this is a conversation, so do get involved. The hashtag is Coalition Conversations, and do make sure that you're following us on Twitter and other social media. This week we have yet again a really interesting lineup of speakers. It's very timely. Ireland this week on Monday we entered into phase 3 and seeing the reopening of our country. And it's really important time to take a step back and to reflect on, at community level, what were the changes to people's mental health. And we're very honoured that this week we've partnered up with one of our members, Samaritans Ireland, to look at some of their qualitative and quantitative data that they've gathered during the 13 weeks of COVID in Ireland. It's also timely for us and a piece of research that we've done in mental health reform, where we have teamed up with the Psychological Research Consortium, which is comprised of researchers from the UK and Ireland, to look at the mental health impacts of the pandemic. And that survey was also launched yesterday, and we will share it in the conversation box. But yeah, so on the kind of the line on the Zoom today, we have Kieran Moore, who is the helpline manager from Samaritans Ireland. We have Maurice, who is the Professor of Computer Sciences from University Ulster. We have Louise Harma, Policy Officers at Samaritans Ireland. And we also have, not as a speaker, but available for comments, and she will be joining us for the Q&A, Niamh Moore from ALONE, who have also shared similar findings to the Samaritans during the COVID period. So without further ado, I'm going to hand over to the first speaker. So Kieran Moore, if you would unmute yourself and your camera and join the call.
Thank you very much, Fiona. Can you hear me okay?
Yes.
I'm just going to introduce the two forms of research that were undertaken and give a little bit of context. As Fiona mentioned, I'm the helpline manager with Samaritans here in the ROI. Samaritans, as you're probably aware, offer a confidential helpline across the UK and the ROI. And here in Ireland, we take about 75,000 calls each month. As it's a fully confidential service, we don't maintain any client records, we don't maintain files on our callers, but we still do have a requirement to have an understanding of our caller behaviour, sometimes just for pure operational purposes, so that we know how to roster people on, and also in terms of the types of needs that people are presenting with. As a part of a process to try and build this understanding of our callers, we've had a long-term partnership with Ulster University, where they have been undertaking some statistical analysis of our telephone logs. So completely anonymized data, but it allows them to understand a lot about the callers. When COVID started and when lockdown started, we had just agreed a second phase of this work with Ulster University. And as a little add-on, they were very kind to do some analysis of the pre and post-COVID period, looking purely at the telephone data. And I think Maurice is going to go through some of the findings on that quantitative research. At the same time, within Samaritans more broadly, we had identified the challenges around COVID, not only for our volunteers, because many would have been cocooning or would have been isolating themselves, but also in terms of our callers. And a very large survey was taken of our volunteers after they finished the call, asking them about the topics of calls, about the levels of distress. And Louise from our own office here in Dublin will be outlining some of these. The two projects happened in parallel, but I think they were covering the same period of time, and some of the same issues were covered in very different ways. So we felt it was interesting to have the two presentations here. I think one of the other things that we had identified was obviously Samaritans is not the only body that is taking calls from people at this stage. And we were very interested in some engagements that we had with ALONE, that they were seeing some reflections of the same issues being presented by callers. So I think Louise will cover that in her presentation. But as Fiona mentioned, Niamh will be here to answer questions and drill down into ALONE. I'm going to pass on now to Maurice Mulvenna. I'll be available in particular for anything around understanding how Samaritans operates or the helpline itself, but I leave all the hard questions will be answered by Maurice and Louise. But thanks very much. Maurice, if you want to.
Yeah, thank you very much, Kieran. Very much appreciated. I'm a professor of computer science at Ulster University. I'm just about to share my screen with the presentation. So hopefully you can see that now. If I don't hear any dissent, I'll assume you can all see the screen share. So yeah, I'm a professor of computer science. All of the work done here is been undertaken by one of our PhD researchers, Robin Turkington, and also key members of the team are Raymond Bond and Edel Ennis and Courtney Paulson. And of course, this initiative wouldn't be possible without the founding work by Professor Siobhan O'Neill, recently appointed mental health champion for Northern Ireland. And we're more than happy with the partnership led by Kieran and Louise and all the other in the team in Samaritans, UK and Ireland. So without further ado, I'll try to take you through some of the findings from our analysis. And it's very important to point out that this is entirely anonymous and not data that we're analysing. We know nothing about content of the calls or who's calling. We don't know the numbers. We have a unique identifier representing a number, but so there's no personal data revealed at all. So in the next 10 minutes, I'm going to be talking about these different areas, and just to pull out a couple of things, we're focusing on the differences in caller duration over the timelines that I'll explain in my next slide, and then we use a technique called clustering, and I'll explain what that is whenever we come to it in the presentation. And then we slice up the data in different ways to look at it. If you want to ask a question, please feel free to put it into chat, and I won't be able to answer it, in the next 10 minutes, but we can address that in the Q&A part of the call. So an important thing to note here is the different timelines. We have what Scandinavians call the week numbers, week 6, 7, 8, and 9. So from the 3rd of February to the 1st of March is what we're considering the pre-COVID week. And you can see in the Gantt chart that this blue band precedes all of those milestones of the lockdown as it encroached on all our daily lives. And this is the lockdown in Ireland, just to be clear. And then so that's pre-COVID window, and then there is essentially a 4-week period when the lockdown encroaches, and then there's what we're calling an active COVID-19. It's actually a 4-week window. I spotted my first typo. So we have 4 weeks pre, then we have 4 weeks whenever lockdown happens, and then we have a 4-week active lockdown. And in some of the analysis in the slides, we also have then another 4 weeks, which is after active, which I'll say a little bit about, but we're mostly looking at the pre-COVID and the active COVID, and then how caller behavior changes from one period to the other, from pre to active. So I'm going to be showing you lots of graphics, lots of pictures, but there's more here than needs to be explained in detail by me. But I just thought I would include more detail for the statisticians amongst you to browse through. And I think these slides are going to be available to attendees afterwards, so you can look at them at your leisure. The key takeaway here is in the top right, we're seeing a graph of the hours of the day for all of the data, and it's the measure on the y-axis is the mean duration by hour, and the red is the pre-COVID period, so pre-lockdown, and the kind of blue greeny is the active COVID period. So you can easily see, I hope here, that in the active COVID period, right throughout every hour of the day, the call duration is longer. I think with every hour, and it's more pronounced in the wee small hours. You can see there at maybe at 3 and 4 in the morning, the active COVID period shoots up, and then around midnight as well. So people are calling for longer in lockdown. And in the bottom left, we see a graph with a double hump in it. And the one scale, the X, you can see is the duration of the call on a log scale. And on the y-axis, we can see the call density. So don't worry too much about what those mean. The key takeaway in this graph is that there are two different humps, and if we look at the red, the pre-COVID, we're seeing that there is there is a hump at about 1,000 seconds. So think of those as long calls, longer calls, in-depth calls with counsellors. Yet there's also quite short, 5 to 10 seconds, and longer, maybe say 30 seconds. Early calls, pre-COVID calls, so people are calling in before the lockdown. Some of them are having quite long calls, some of them are having quite short calls, checking everything's okay, maybe having a short conversation. But in the active COVID period, we're seeing that the longer calls, the second hump is getting bigger, and the shorter calls, the hump on the left is getting smaller. So people are calling for longer is a key takeaway. And we see that if we look at those two graphs, the top right and the bottom left, we can see that pretty clearly. Here Robin made a little movie, and this is looking at 16 weeks of data. So this is the pre, the during lockdown, the active, and then the weeks afterwards. So you can see that that if we look now, we can see that the longer duration is growing, and then it starts to decline post-active. So we're getting back to normal now after the distress caused by lockdown, affected by people calling for longer. So as I said, I would explain what clustering was. So clustering is just a way to make sense of data without knowing very much about the data. Would be a layperson's definition of it. We use a technique called K-means clustering. So we're just looking at some dimensions of the data. The call duration would be one feature or variable we'd look at, and there are others. And then we try to visualize that using this technique to sort of identify the differences in the data automatically using these kind of algorithms. And to cut a long story short, we have found with the Samaritans data, going back many years working with Kieran, that there are 5 types of clusters that exist, and this is obviously completely anonymous. So there are high frequency callers, people who call a lot, and then there are so-called typical callers. These are the largest number of callers. They make about 5 calls on average, maybe 4 minutes long, and so on. We also have regular callers, unpredictable callers, and single lengthy callers. And apologies for these labels, they're just working labels that allow us to talk about the different clusters in a way that makes sense to us. So focus on the high frequency callers and the typical callers, because those are the clusters that represent people who are calling who have changed the most. Another little movie here, if we look at the high frequency callers, you can see that the it's changing dramatically. If we look at the typical, we can see a change, quite a dramatic change. Some of the other ones are changing and appear to be changing dramatically, but their shape isn't changing so much. So if we look at at these clusters, we're seeing some of them are changing and some aren't. Again, we can look at, this is looking at the duration again. If we look at the high frequency callers, the pre is the red, so we can see the humps here in the left. Is declining as it changes to that bluey green color. The short duration call hump is declining, and the longer duration call hump is increasing. And we see that also with the typical callers as well. So all of the clusters are changing a little bit, and all of them seem to evidence that the people are calling for longer calls. Here I'm just going to move through these two that shows the breakdown over the hours of day by the clusters, and we can see this as a movie. And I guess the information value of this movie is not as high as its aesthetic niceness in showing how the clusters change over time. So there's quite a lot discussed there. And my last kind of detailed cluster graph here, looking at all of the calls, looking at mean duration here. We've smoothed data out, so we can see again this change. So the red is the pre. We look at the top left, high frequency callers over a day. You can see that it's changing from pre to active. More calls early in the morning by this cohort. So high frequency callers are calling more regardless of what time of day it is, but much more in the morning. Typical callers, a bit more in the wee small hours, as is the case with so-called regular callers. Not so much on the unpredictable callers and single lengthy callers, but they do change as well, but you can see it's not so significant. So the a couple of digressions here. The first one, and I'm nearly done. The first one is the looking at callers who were in the pre-COVID, people who called in the first 4 weeks, and also had called in the active COVID 4 weeks. So their caller tenure spanned both periods. So we were interested in those people because those were people that we knew, or rather telephone numbers, representations of numbers that we knew were calling before the lockdown that were also calling afterwards. So if we look at the top left here, we're seeing also that these people who were calling the Samaritans, who were seeking assistance from Samaritans volunteers before lockdown, were calling more in the active lockdown period and much more in the first half of the day than in the second half, if we can put it that way. And then in the bottom left, we see in the density plot, again, the pre to post flips from more longer duration calls and fewer short duration calls. So that was interesting. That told us something about the people who are calling pre and post. And then if we look at this is just showing the two different graphs, one for pre on the left and one for active on the right, for callers common to both 4 week periods, to visualize them in more detail. If we look at the people who weren't in the first 4 week period but were in the second active period only, we can see something about them. Maybe start here at the bottom left and look at the shape of the caller duration for these new callers. Overwhelmingly long calls. No evidence really of a short call hump at the left, around 5 to 10 plus seconds. So these people were new callers and clearly wanted to speak for a very long time. So that's a whiz through all of the data. Just to summarize that, we can see that fewer calls, calls up to 5 minutes can be perceived as kind of a checking in call, and more than 30 minutes is more people engaging more with volunteers and requiring some kind of support. So we're seeing that change in the typical and high frequency callers, and that change is more pronounced from 1 a.m. to 6 a.m. So what we think happens, and this is a hypothesis, and we can discuss maybe in the Q&A, is that people don't have access to other extant mental health supports, and perhaps they have fewer avenues of support to go to, either virtually or face-to-face. And then the one of the few remaining avenues, such as Samaritans, people are staying on for longer. So this matches the anecdotal evidence saying they're not seeing a massive change in call volumes, but they're seeing that people have more distress and a higher need for support. So that's very interesting. We note that if we look at, as I was saying, from the pre-COVID weeks, the pre-lockdown weeks, to the active COVID weeks, where we're seeing this distress evidence in the data, to the weeks 18 to 21, which is, the more recent post-active weeks, have shown the perturbation and duration. But now we're seeing, in that last 4-week period, we're seeing a apparent return to some kind of more of a norm in the last 4 weeks. So it'll be interesting to see if that, if we look at the data again, are we really back to normal, and is it a new normal or whatever. So thank you very much, and I'll now pass it back to Laura. Thank you.
Thank you so much, Maurice, and thank you for bringing that data to life. It's really striking, and to someone who may not have that skill set of analysing numbers and stats, it was really clear, the key trends that have come out of the data. And it's quite interesting, and I think it's really important learning. We don't know the future. We don't know if we're going to go into a second lockdown at some stage towards the winter months. But I think it's really important, that we're engaging with policymakers now to see how we can prepare. Preparation is key in terms of people's mental health and the mental health services going forward. And this data clearly evidences the need that people were under, higher levels of emotional distress during COVID, and their current, the services that they may have been attending were not available or may have been delayed, and that they needed to reach out to those services that were, still keeping going during the lockdown period. So yeah, thank you for bringing those points to life, and I'd be interested to hear in the discussion people's thoughts on, how can we ensure that we've learned from this and that we're implementing, we're implementing kind of a reaction going forward. So now I'm going to ask Louise Harma from the Samaritans, the policy officer, to turn on her video and her mic and to give us the second presentation. So Louise, the floor is all yours.
Hiya, let's just get this screen shared here. But I assume that if it's not working or you can't hear me, that someone will let me know. So just following on from Maurice's presentation, I'm going to share some of the findings from our Samaritans volunteer survey about their experiences and what they're hearing from callers during COVID. So before we begin, just going to give a really quick overview of Samaritans in case you're not familiar with our organization. We are a volunteer-based service that provides free listening support. So we're available 24/7, 365 via phone, email, and letter. And then during non-COVID times, we also operate face-to-face listening support in our branches. We are across the UK and Republic of Ireland. We have around 2,300 volunteers in Ireland and 22 branches across the 32 counties. So just a lingo I want to clarify, because it will come up in the presentation, is that Samaritans refers to anyone who avails of our support as a caller. So this includes people who write emails or write us letters or speak to us in branches. And then again, to just reiterate, as both Kieran and Maurice have said, that Samaritans calls are anonymous. So everything in this survey is just a summary of what our volunteers are telling us, not individual accounts. So Samaritans is deemed as an essential service. So our phone lines and email and letter services remained open even during the height of the pandemic. In the first 13 weeks of lockdown, Samaritans volunteers provided emotional support nearly 645,000 times. So that's across email, letter, and phone calls. And across our nations, we are currently providing support over 7,000 times a day, with a Samaritan in Ireland answering a call every 49 seconds. So in March and May, we carried out a baseline and follow-up survey with our volunteers who have completed shifts during lockdown. And our volunteers have reported callers have mentioned COVID specifically in 1-3 contacts, but they say that they're noting that COVID seems to be impacting all callers, even if they're not explicitly mentioning it. And as Maurice spoke to in his presentation, Samaritans is not seeing a significant change in the number of calls that we're receiving. However, the calls are increasing in duration, which is an indication that callers are needing greater levels of support. Samaritans has seen an increase in emails as callers, we believe callers may be finding it difficult to find a private or a safe space to talk on the phone during lockdown. Volunteers are telling us that people who phone us, who phone for phone calls, are appearing to center more on a need for human contact, whereas callers using email are oftentimes seeking more in-depth emotional support. So the most common caller concerns explicitly related to COVID are things around loneliness and isolation, mental health and illness, family issues and finances, and unemployment. Our volunteers suggest that our callers are not any more or less suicidal than before the beginning of COVID, but that callers are generally more anxious and more distressed. And the volunteers have noted ways that callers talking about their concerns have evolved from the beginning of the pandemic, where concerns were very physical health related, so not wanting to get sick or not wanting others to get sick, whereas now their concerns are shifting more to economic and social and mental health impacts that COVID's having on their lives. So as families have been quarantining together, oftentimes with very little outside interaction, we have seen an increase in callers talking about household tensions. Family-related anxieties have also evolved throughout the pandemic. So in the beginning, we mentioned families were concerned about loved ones contracting COVID, whereas now callers are more worried about the financial impact that the lockdown that COVID is having on their families. But throughout lockdown, callers have been concerned about being separated from their loved ones, especially more vulnerable family members like parents or grandparents or those who have pre-existing conditions. And callers have talked about facing the internal dilemma of wanting to care for these loved ones, but also knowing that they need to stay away, and because they don't want to be a carrier and infect them. So there's been that internal, struggle. And as lockdown was in its continuing deepening stages, we saw an increase in calls from younger people who were frustrated by having to live with their parents. And equally, we saw calls from parents who were having difficulties homeschooling their children. In the beginning, our volunteers noted that caller concerns were quite hierarchical in their sense of needs. So meaning, in the beginning, callers were very concerned about accessing essential goods like food and pharmacy and benefits. Many callers have also been worried about losing their jobs or losing their businesses, being furloughed. And unfortunately, some of the volunteers have reported that they've received calls from people who these worries have come to be, so they have lost their jobs or been furloughed and things. We've also seen throughout the pandemic, we've also seen worries around callers where we're not being able to make rent or their mortgage payments, saying that the financial assistance from the government just isn't enough to help cover these things, or fear of homelessness as well. And now, as lockdown restrictions are beginning to ease and places begin to reopen, people are going back to work. Volunteers have said that some callers are now showing concern about the pressure to go back to work, especially if they don't feel ready or safe in doing so. ALONE, Samaritans Ireland, and specifically Dublin Samaritans agreed an MOU at the end of April. ALONE has and had seen a rise during COVID of callers reporting negative emotions, including suicidal ideation. And ALONE volunteers were sometimes feeling overwhelmed by the levels of emotional distress being expressed by their callers. So they have been referring those callers to Samaritans since the end of April. As of Monday, and from the end of April to Monday, ALONE had made 25 referrals for 22 individuals to Samaritans who were experiencing those extreme levels of emotional distress. And ALONE has reported receiving over to their general befriending services and support line, has received over 25,000 calls and has made over 119,000 calls and supported over 13,000 older people since the very beginning of the pandemic. So Samaritans has seen an increase in the frequency of conversations about callers' existing mental health conditions, having been exacerbated by COVID and the lack of access to supports. Now, as lockdown is easing, we're also hearing additional reports of insufficient or inadequate mental health supports. So the Samaritans Helpline has been used as an alternative by some callers to kind of fill this void, even more than usual. Many Samaritans callers are talking about loss of their usual coping strategies and support networks, which has meant that most said they are sliding back into old habits or spending more time just ruminating on old unpleasant memories. And ALONE has reported, similarly to Samaritans, that while the number of people looking for support for their well-being and mental health has reduced, the support needs of those who are reaching out has increased, and that housing, befriending, and emotional and mental health are their highest areas of need for support in coordination cases right now. ALONE reports that while the country is reopening, it's important to remember that it might not be happening at the same rate or the same pace for everyone. So many older people or vulnerable people are still cocooning and facing ongoing isolation from their family, even if others are beginning to re-enter a more normal life. And Samaritans has seen an increase in the frequency of conversations about callers' existing isolation. I also just want to note that it's important that we realize that not everyone talks about isolation in the same way. So some may use the term isolation because they feel isolated because they're living alone or they're living in a geographically isolated area. But equally, others could use the term isolated to kind of describe how they're feeling if they're feeling cut off, even if they aren't physically alone. So everyone uses that term a bit differently. However, anxiety about isolation has been a common theme since the beginning of the pandemic. And now as restrictions are being eased, we're finding that callers are beginning to worry about the new rules of social interaction. So things like social distancing or being advised to limit physical contact, even with family members, grandkids not hugging or kissing, their grandparents, or even, reducing how often we shake hands. And ALONE has reported that several older people have spoken about just wanting a hug, and Samaritans has seen this similar trend with an increase in calls of people who are just wanting to talk to someone. So in the interest of time, I'm just going to wrap up quickly, noting that Samaritans has seen an increased need in mental health supports, and there have been reports of a decrease in availability and accessibility of these supports. So neither Samaritans nor ALONE have seen a significant increase in the number of calls and reach outs that we're receiving. However, we're both noticing that the levels of distress and support that are required for these contacts has increased. And as measures such as social distancing and cocooning continue to fight, in the fight for COVID, things like loneliness and isolation are likely to continue and continue to increase. So it's important that public policies are created to ensure the issues that were both created and exacerbated by COVID are addressed going forward. So this could be something like things like increased support and funding for community-based services that will help develop social connections and foster a sense of community, much like we saw in the beginning of the pandemic with local groups who were really stepped up, and were delivering shopping or offering to go, knock on doors of people who might be housebound and living alone. So there are services like this can help people feel less alone, and can be delivered in a way that can still abide by any social distancing guidance that's with us. It's also really important to remember and to remind others that supports are available for people who are struggling to cope. So we need to continue to encourage help seeking by signposting to sources like Samaritans and ALONE. So I'd also just like to quickly thank Mental Health Reform for inviting Samaritans to be a part of the webinar today. And then I'd also like to special thanks to ALONE for sharing some of their data with us and their volunteer information with us, as well as Neve Moore, who I know Fiona mentioned, is online as well. She's a loan services manager, so she will be here to answer questions on a loan. So thank you.
Thank you so much, Louise. What an interesting presentation. There was so much in it. I think that's so relevant to our work going forward. You know, particularly I think young people. You know, you've mentioned the additional kind of strains and the additional calls, and the fact that we're moving from that crisis mode where now people are really looking at the future, and it probably relates back to what Niamh will talk about as well, that, you know, we can't treat this homogeneously. Like, there are people who have been impacted greatly. You know, I think someone said that COVID is a great leveler, but while in fact it wasn't, that it's still, you know, those vulnerable groups in society that ultimately do feel the impact of COVID. And as we're coming out of lockdown, it's important to realise as well that there are certain groups in our population, including those who are kind of in that over 70 group, who've had so much already in terms of cocooning. We've seen that women, we've seen that people from lower socioeconomic groups don't have access to technology, so they're not able to access services. So I think, you know, within your presentation, that struck me as well, that the data was really showing the need to continue to look at the barriers that different groups are facing and will continue to face going forward, and that we really need to ensure that we're communicating strongly, that services are available, that help is there. So thank you for that. Yeah, so now is the Q&A, and we've lots of time left, I'm delighted to say. And I'm going to hand over to my colleague Amy, who has been monitoring the questions. I would ask you all to continue to submit questions using either the Q&A function or the chat function. But I'm going to hand over to Amy so that she can put the questions to our esteemed panel. But many thanks for all the wonderful presentations. They were really rich.
Thanks, Fiona. Yeah, and I just echo what Fiona said. Thank you to all the speakers today. Really, really interesting to see kind of the qualitative and quantitative data backing up what we expect has been happening on the ground. So we will just jump straight into Q&A. I see a couple coming in here in the chat function. So we have a question, and I think, Kieran, you spoke to this in the chat. The Ulster University figures, where do they cover? Do they cover Northern Ireland or all of Ireland, or just the Republic?
It's the Republic. I think Maurice can give the details of the dates of it. But our phone service, while we deliver the same service in the UK and the ROI, for regulatory reasons to do with Children's First and reporting into TUSLA, we have a ring-fence service in the ROI. So all of the figures we analysed, it just made more sense to do the smaller data set. So Maurice has been looking at the ROI figures. So it would be the Republic of Ireland dates for the for the start of lockdown would be the start of the post-COVID period.
Okay, thanks, Kieran. We have another one here from Donna. Were volunteers supported during COVID-19, and what supports were put in place for them?
Well, I mean, we would have an awful lot of supports already in place for our volunteers. There's a sort of a formal offload and debrief at the end of calls, and we would have built up over 50 years a lot of expertise around that. An awful lot of it is based in the branch. As Fiona was mentioning, the cocooning of 70-plus-year-olds impacted not only our callers, but also quite a few of our volunteers. So we had two major things. We put email from home so that some of those cocoon volunteers could be at home, but we had to build support structures around that so that at the end of handling an email, they could talk to somebody and they could be supported. And secondly, we then did a lot of work, social distancing and hygiene practices within the branches, which, you know, we have an enclosed duty room that people access and that you need a keypad to get into to be able to take calls. We actually had to spread that out to make sure that people weren't sitting with each other, you know, make sure they weren't sharing equipment. So we would have done the same as a lot of other office-based organisations. The more distressful calls that we saw, I mean, to be honest, that is the core of the support that we give anyway. You know, how you at the end of, you know, because it is a confidential call, you can't go home and tell your spouse or your partner to know what happened today when I was on a Samaritans call, but you still need to have that offload. So we would have an awful lot of strong practices around that.
Okay, that's great, Kieran. That's really good to hear. 1 sec now, sorry, there's loads coming in the Q&A. One for Maurice. Maurice, do you know if there's a similar pattern in the north of Ireland to the south?
I don't know as a scientist because we haven't analysed it. But from other research questions where we looked across the different areas of the UK and Ireland, we found that there was, for example, the clusters that we have identified are also manifest in the other parts of the UK, as well as in Ireland, north and south. So they're stable. So I would expect that to find the same patterns in Northern Ireland data. The time lag might be different. You know, the time scales might be skewed a wee bit, you know, given the policy impact as coming at different times. Thanks,
Maurice. Thanks for that. Okay, do Samaritans have any data on ethnic or language diversity of callers, and can you provide support to persons with poor levels of English?
I suppose it's very difficult. The way that our system operates, it's an entirely anonymous helpline. Everybody rings and then gets matched with a volunteer, but we don't sort of route those on any basis. In the UK and Wales, there is a Welsh phone line, and it is something that we've examined here, whether there will be a need for it. That's a separate phone number staffed by Samaritans volunteers who can deliver their service in Welsh. We haven't done that here. We also, because it's a confidential service, we don't capture data on ethnicity of callers because it's a voice call, and we don't ask, you know, we don't sort of query our callers when they come in. The first question they get is, how can we help you? So we don't, you know, fill out a questionnaire. And I think it is something that we're conscious of, that there is a diversity in our callers that we need to reflect back in terms of our volunteers, and you know, but it is not something we'd have hard data on.
Okay, thanks for that, Kieran. Have any trends regarding misuse of service been observed between pre and active periods?
I suppose, again, we have a logging system where we don't give details of the phone number or the person's name or anything, but we do log calls for the topic that comes up and so on. And I mean, I can look this up, but my feeling is that we've had a slight reduction in the misuse of service. And in particular, we've had, I mean, as Maurice mentioned, we've had a reduction in the very short calls, which are quite often a sort of a testing call, and instead a move to longer calls. And generally, you know, our volunteers are well trained to manage a misuse of service. So there's a reduction in those because more of the calls are the 20 to 30 minute, you know, more detailed calls where support is provided rather than the misuse of service. But again, this is data that's contained in this logging system rather than our phone system. And it's one of the problems with the confidential service is you're matching up different data that you can't definitively say, you know, this was the time of day or this was the time. But there has been some reduction to match the increased levels of distress people are presenting with.
Okay, thanks, Kieran. That's really interesting. And then Mary asks, do you have information about why the numbers didn't change a huge amount while the severity and duration of calls did?
We actually had very interesting conversations because one of the first things that we looked at was the frequency of calls and the volume of calls rather than looking at call duration. I think we did struggle in the early days to deliver a full roster. We lost about 40% of our volunteers, and in the ROI we have 13 branches, and at various times 4 of those closed for a period because there was a COVID case within the volunteers. So one of the things that we were very conscious of was that it was difficult to measure volumes of calls because at times we didn't have enough volunteers there to answer the people who were coming through. So we didn't put a lot of focus on that because that was seen to reflect the numbers of volunteers we had rather than the callers in particular. I think one of the things that we were surprised by, though, was that it was two specific cohorts of callers, these clusters that Maurice talked about. The changes in behaviour were very much within these two particular clusters of people who ring us regularly change their practice. So we didn't see an increase in the overall number of people calling us. That stayed, it's about 4,500 individuals per month would make the phone calls. That stayed consistent. We didn't see growth in the other clusters of one-off callers or so on. But in those sort of frequent callers and typical callers, that particular cohort. So I think we did see existing callers changing their behaviour rather than loads of new people ringing us.
Yeah.
And we can only kind of hypothesize, why that is, but one of our assumptions is that's because other supports were no longer available in the same capacity, so that where those callers might have been receiving support elsewhere, they were now using Samaritans as their point of contact, which would make, would result in longer conversations or things like that. But that's just a hypothesis we don't have. But that's our assumption.
From Alone's point of view, we obviously extended our service hours, so we did see an increase, but also an increase of people who wanted additional supports. So our telephone and befriending service was typically Monday to Friday, 9 a.m. to 1 p.m, and we extended it from Monday to Sunday and added in afternoon and evening calls. So we would have seen a huge increase in people who might have got a call once a week before, who wanted a call up to 7 days a week, particularly at the start of the pandemic.
Great, thanks for that, Niamh, and thanks, Louise and Kieran as well. Okay, another question coming in. Did you have any callers from asylum seekers for support during COVID lockdown? How can they connect? How they can connect with you as they don't have much information available? Did Alone or the Samaritans see many callers from asylum seekers? It might come back to what you were saying earlier about the fact that you don't collect that type of information.
Yeah. Sorry, go ahead.
Sorry, no, I was just going to reiterate what Karen said. We don't collect that data, but in terms of Samaritan services and Alone services are free. So in terms of how an asylum seeker could contact Samaritans, a mobile, even without credit, you can call 116-123, and that will put you through to a Samaritan, as well as email. So, and then in terms of earlier question had to do with levels of English, and our volunteers, it is an English language run service. However, our volunteers are trained to listen, so there should be no pressure or rush in terms of having to speak everything perfectly or clearly, and our volunteers are very good at just listening to whatever they need to say. So
great, thanks for that, Louise, and we will be sharing the slides to all attendees afterwards, which have the contact details on it as well, so they'll be available. As well, I suppose, what are some of the key concerns going forward for the Samaritans and Alone as we kind of come out of lockdown and the uncertainty that brings? What are some of your key concerns in relation to that?
Well, I suppose, we have very basic operational concerns because we have an awful lot of volunteers who are now returning, who are very nervous about coming back in. So we're equipping them with their own headsets and things like this just to manage that. I think the other thing that we saw in the financial crisis in 2008, 2009, that it was only after the initial shock in 2010 that we received a large increase in calls with people concerned about financial issues. And I think it will be the disparity of levels of recovery, as some people go back to work and some people don't, as some people take up normal life and others are still cocooning because they're concerned about their health. That accentuates the isolation and accentuates the distress of those who are left behind. So, going on the experience we had in 2010, that there is a lag, and it's as some people recover, that makes your own issues more difficult. And so we're very conscious that we would expect to see an ongoing increase going into the autumn as Ireland opens up again.
For sure. Yeah, thanks, Kieran. That's a really good point. Niamh, I don't know, did you want to come in on that? Is there anything that Alone are particularly worried about going forward?
I suppose for the callers, our service is still 8 a.m. to 8 p.m. Monday to Sunday, and the calls that we're experiencing are people who are still cocooning, who are concerned about the country opening back up, and them not being able to, them still isolating. I suppose with the volunteers pulling back, going into other jobs as well, practical support, people who still need assistance or practical support, that's also a concern for some of the older people calling, because those volunteers, like I said, are going back into their previous roles.
Yeah, okay, thanks, Niamh. We're just about out of time, guys. So I think I'll start wrapping up the Q&A, if that's okay. But I want to really thank all our speakers today. I think it's been so interesting for everyone, like I say, to hear about what's happening on the ground and what you're experiencing as a helpline, and the changes during COVID as well, because we've heard it anecdotally, but to see some data behind that as well, and to see the levels of emotional distress in the community, it's been really interesting. And thank you to our attendees for all being here today as well. We hope you really enjoyed it and got a lot from this webinar. I have shared a link of a feedback form in the chat. If you would all please give your feedback, that would be really helpful, because this is a new initiative, and we want to hear how you're enjoying it. And just to prove that we do read the feedback forms, something that was heavily suggested was a topic on youth mental health. It came up over the last 2 weeks that people really wanted to see this, so we're going to be looking at that next week, and we will be advertising that over the next few days. So do keep an eye on our social media. Our Twitter handle is MHReform. So thanks to everyone, and yeah, thanks again. I'm going to end this here.
Thanks.